So today I will discuss some stations, and these stations, the purpose of the station is not taking detailed history. The purpose of the station is lifestyle modification. Again, I will discuss today some stations. The purpose is lifestyle modification, which I call them the PAN stations. So these stations, Dr. Maha, now the name will be for about 2 years on the course. So the PAN stations, the PAN, this is the PAN, and I will close all the holes in the PAN, which is diabetes, cholesterol, and heart problems, which means heart problems, heart attack, for example, yeah, strokes and mini strokes, and DASA, lifestyle modification, DASA, diet, exercise, smoking, alcohol, and in the middle, in this heart, thyroid. So this PAN stations, every single station I will discuss, you must, diabetes, cholesterol, hypertension, high blood pressure, yeah, heart problems, stroke, mini stroke, and DASA. Basically, if you think about it, they are what we call them the modifiable risk factor, which is diet, exercise, smoking, alcohol, modifiable things. If we improve, it will decrease the risk of you having such a problem, yeah? So the stations are, so you can write down the stations that in these stations I will use this structure. This structure is the PAN stations. The PAN stations is the medical condition. You know the medical condition, yeah? I always say, guys, ask about past history and past medical condition. P2, what is P2 in the structure? Is past history of presenting complaint and past medical. These are the past medical condition, the 5, yeah? Diabetes, cholesterol, high blood pressure, heart problem, stroke, mini stroke, and thyroid. 1, 2, 3, 4, 5. What is P3? P3? DASA. So this PAN is in brackets P2 and P3. Guys, the stations I will mention, they have been designed for you to advise the patient about. That's it. Because the confusion is some doctors, they go thinking it is a medicine station, thinking it is medicine. So they keep taking history, and then when it comes to advice, they don't have time, because when you advise here, you need 4 minutes. 4 minutes to talk about this? Yeah, 4 minutes. To say to them, what type of food do you eat? What do you think of doing this? Can you do that? What type of exercise you do? What do you think of that? So when you advise about DASA, when you advise the patient about diet, exercise, smoking, alcohol, you need to have your time. Can you come and say to me, I will convince you to stop smoking shisha in 30 seconds? Seriously, you can't. Someone who smokes, can you convince him in 1 minute? Diet. Can you convince someone? Only if you try to go on a diet, then you will realize how difficult it is. I've been for about 1 year now trying to go on a diet. So 12 in the midnight, wallah, 12 in the evening, before I go to bed. Tomorrow morning, I will wake up in the morning, no fizzy drinks, nothing. I will eat healthy, wallahi. I woke up in the morning, 8 o'clock, by 10 o'clock, half Monster. Just take half, and then that's it. By 12 o'clock, I'm going back to normal. So my point is, if the station is for you to advise, it is just for you to advise. So what are the stations? And remember this word. You're not gonna have an exam, Lab 2, without one of these stations. Go check every day, yeah? Number 1, Number one, stroke. Stroke. There is a station about stroke. Number two, TIA. 3, post. Post? What do you mean post? MI. Post MI? Yeah, post MI lifestyle modification. So the station is not an MI station. He's managed. He's fine. Talk to him about lifestyle. So this station is not medicine. This station is not tell me about your chest pain, explore it. No, this station you will see, it is only about DESA, post MI. He's stable now. And finally, diabetes stations. All diabetes stations. All of them, if you don't talk about DESA, you fail. So, Dr. Mo, will I take history here? No. I will tell you the amount of history. Which, Dr. Ma, this is what people do wrong. People think that on the station, I will take full history and I will advise full advice. No. The station is other history. It's either MI, severe central crushing chest pain, history, where does it go, how did, or he's stable and advise him. So it's just advice. It's not MI, it's advice. Again with stroke or TIA, it is just advice. It is not a TIA. So they cannot bring in PLAB 2 a station with advice and what people do wrong with these stations, they take it as medicine. Where was that chest? Where was that chest? He's stable now. He doesn't have a chest pain. He's fine. The question will say the patient is fine. Where was, 4 days ago? Explore and tell me how was the chest pain. Doctor, it was very severe. Did it go to your left shoulder? Yes, it went to the left shoulder. Did it go to the left jaw? Yeah, brother, it is diagnosed. The patient is stable. And the question will say to you, I will tell you now about the question. The question will say, he is stable. He's fine now. He's going home. Clear. I have focused enough now. It sounds quite boring, but because this is your problem, that you want to take history, but there is no history. Okay? So, all these stations. Number one, before you leave the cubicle, make sure you ask in details about DESA, which is P3. And ask about the medical condition, which is P2. And make sure before you leave, you will advise fully about DESA. DESA fully. Okay. This is the first rule in this station. So let's give you the stations. Write it down, the OSCE, the question, and then let's tell you how to approach it. The first question. "60 years old. Andrew was admitted with chest pain." Doctor, can you tell them to close the door? Or 60 years old Andrew was admitted with chest pain. He was diagnosed MI and was treated for MI. He is stable now. Wallahi, this is what the question will say. He is stable. Your consultant has prescribed him some medications and he is now ready to go home. Talk to him. Okay? Where is the task now? Assess him clinically and advise him about lifestyle modification. This is the question. So, is the patient stable? Is he in pain now? Has he managed? Is he managed? Yes. Your job is assess him clinically and talk to him about lifestyle modification. So this case simply, I will take this now. So this case simply, "Hi, I'm Dr. Fatih Al-Bab, one of General Doctors here. Can I please confirm your full name and date of birth? My name is Andrew Thompson. My date of birth, 10th of January 1955. Well, Mr. Andrew, I can see from my note that you have been admitted in the hospital or you presented to the hospital 3 days ago with chest pain. Yes, doctor. Are you in pain now? No, doctor. I'm glad. Do you have any concerns? No, doctor. Done. This is the first part of he's fine, no pain, nothing. Okay. My consultant has prescribed for you some medications, the question said. Yeah? Do you have any concerns about? No, doctor. No. Do you feel ready to go home? Yes, doctor. I'm glad. I'm happy to go home. Done. Now your station will start. Mr. Andrew, before you go home, is it all right if I have a chat with you to make sure that everything is okay? And in order to give you some advice, because we don't want you to go through this experience again. Why do I chat with him now? Because I don't want him to go through the experience again. Okay. Now, the start of my station, in order, the patient had MI. So I want to check, does he know what MI is or not? Then tell him the causes of MI. Then when I advise him, he knows that I'm advising him because I don't want him to go through MI. So I will tell him, Mr. Andrew, the first point in the station, I will assess his knowledge. I will assess his knowledge. Mr. Andrew, do you know what MI is? No, doctor. MI is the heart attack, or we call it heart attack. It is decrease in the blood supply, or sometimes complete blockage. So decrease or complete blockage of the blood supply that supplies the heart. Mr. Andrew, look at the next phrase. It is life-threatening condition, I'm afraid. It is life-threatening condition. That's why we don't want you to go through this again. Guys, why did I say life-threatening condition? I'm giving him a shot that, Mr. Andrew, I'm here because we don't want you to go through. Guys, please tell the patient the reason why you are here. Mr. Andrew, heart attack can be caused by many factors. Some of them modifiable, which means we can work on them. What do you mean you can work on them? We can work on them and we can decrease the risk of you having heart attack. However, some others are non-modifiable, which we cannot do anything about it. Like, for example, the age. Usually patient, when after a certain age, they have high risk. For example, the fact that MI affects male more than females. However, there are some things that if we work on them, will dramatically decrease in the chance of you having heart attack. So, is it all right if we have a chat in order to be able to establish what's happening and work on these things? So, does he know why you are having a chat? Why? Why are we having a chat now? Because we don't want you to go through this again. Does he know what MI is? Yes. Now, does he know why I'm gonna take history? Yes, because I wanna know the risk factor that we will work on. Does that make sense? Guys, this is PLAB 2. PLAB 2 is understanding. We both know what we are talking about now. So, I will say to him, so, Mr. Andrew, I said, now I will start my station after assessing knowledge, yeah? I assess knowledge. Now I will start the station by, I said to you, they are all called the PAN stations, which means P2 and P3. So I will say to him, Mr. Andrew, do you have any medical conditions? Like diabetes? What about cholesterol? High blood pressure? Have you ever had heart problem, heart attack before? Any strokes or many strokes? P2. That's P2. What is P2? P2 is the 5 medical condition. So I have asked him P2. P2, how many questions? 2. P2 is 2. The first question, have you had this before? Have you had heart attack before? The second question, any medical conditions, like, and name them. Okay, what is P3? Mr. Andrew, I would like to signpost it, make it nice. I'd like to ask you some questions. I'd like to have a chat about your lifestyle, if that's okay with you. Ask about diet, ask about exercise, smoking, alcohol, and the history is finished. And if you want to make it very, 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 very perfect, you can ask family history. Because family history is one of the non-modifiable risk factor. The non-modifiable risk factor, age, gender, and family history. The modifiable is the PAN. That's why I'm saying ask about the PAN, because it's modifiable. What do you mean, Dr. Mo? If he's having high blood pressure, do you want to manage it? If he's having, yes. If he's having, he's diabetic, yes. If his cholesterol high, yes. DESA, can you manage them? Can you work with, yes? And if you work with them,
He will improve.
he will improve. So please, Dr. Amaha, he needs to know that these are the factors and what am I and the causes. Please, in order for him to listen, because he wouldn't listen if he doesn't know. Why should I change my diet? I should change it because it's one of the causes, and if I don't change it, there is high chance of having heart attack,
Again.
and it's life-threatening. You see, it is what
Like
I told him. Yeah. So diet, exercise, smoking, alcohol, and after that my history is finished. History is finished. I finished. Now the other 4 minutes, Doctor, what's your name? Dr. Isra. The other 4 minutes is what?
advice.
Is advice
About
about what? Lifestyle modification. That's it. So the other 4 minutes will be arms. Arms. What's arms? Advice, risk factor, medication, and the investigation, multi-disciplinary team, safety rating. Station is finished. That's it. This is my station. That's as much history as you can take, and that's it. So now, Mr. Andrew, as he spoke, as you took the history about DESA, there are 2 ways. Either as you go advice, which I like, or after you ask all DESA, start arms. Arms is the management structure for counseling station. Dr. Mo, is this counseling station? Guys, it is counseling. What is the meaning of counseling? Is it diagnosed? No, I mean, is it diagnosed? Is there diagnosis? Do you need to diagnose?
Yeah. No.
Do you need to investigate?
No.
It is diagnosed. It's MI. That's the meaning of counseling, which I use arms. So, either I will ask him, how's your diet? He will say, my diet, I eat pizza and burger. Then you can
Advice and advice.
right away. Or after asking about diet, exercise, smoking, alcohol, you can then start to manage. Do you understand this?
Yeah.
But I will go with arms, so I don't forget my structure. Because if I advise as I go, and then I'll be lost. Like, did I finish? Sorry? What did I forget? I forgot this. You understand me? So I would like, after asking about DESA, so Mr. Andrew, now we'll start talking about arms. Mr. Andrew, from the history that you told me, well, and then start. Guys, and do you know that A and the R, they come together? What do you mean by that? The advice and the risk factor. So I will tell him the risk factor, and then I will go for advice. So, Mr. Andrew, as you mentioned to me, that you eat burgers, pizzas, guys, because unless you have time, you're not gonna be able to have this kind of chat. So that's why the history should be focused. Mr. Andrew, as you mentioned to me that you eat pizzas and burgers, and you eat fried food, a lot of fried food, which one of the risk factor why a patient, don't tell him you, why a patient can have heart attack. So I highly advise you, if we can make some lifestyle modifications so we can change the type of food that you eat, try your best. I know it's difficult, but we don't want you to go through this again. So please make it as if it is optional, because it's optional. If you advise me about diet and I'm not gonna follow, can you force me? Guys, can you force him? You can't. That's why. Please make it sound for him as it's optional, because if you make it as you are forcing him, it's not gonna work. So, Mr. Andrew, I highly advise you that you start changing or making a bit of modifications. Guys, you see, when I say a bit of, doesn't sound as bad, okay? So I might spend some time in showing you how you advise about lifestyle, but it will help me in the next station. So the next stations, I'm not gonna talk in details because I will say it once, yeah? So I highly advise you, if you can make some modifications. What do you think about it? Yeah, doctor, yeah. And you can throw a phrase in the middle. Well, Mr. Andrew, all of this because we don't want you to go through this terrible experience again. You see? All of this because we don't want you to go through this terrible experience again. So, what do you think of starting at first? I asked about diet, so I know what he eats. What do you think of eating white meat, more of white meat, okay, than red meat? Because white meat has less fat, has less cholesterol. Can you do that? Yes, doctor. Also, may I ask you, what type of oil do you use? Don't say to him, use olive oil, doctor. Or use olive oil, Andrew. Yeah, I do use, doctor. You will look like stupid, you know. So please ask first before you. What type of oil do you use in your food? Doctor, I use such and such. Well, what do you think of using olive oil? I think it's more healthy. Let's try to use it. You understand? So white meat, olive oil, then you can ask him that, do you prefer more of fried food or grilled, or why I love my food in oil? Well, oil can be one of the factors why you can have high blood pressure and why you can have clots in your blood. So what do you think, Mr. Andrew, if you start eating more of grilled food than fried? Guys, please, before you direct something, ask. Because it will look so bad if he say, I eat grilled food anyway. You are talking about grilled food and he tells you, I eat grilled food. So before you say eat grilled food, ask, what type of food? Do you like the grilled or the fried? Because if you said the grilled, what would you do? Carry on, well done. But if I said fried, advice. Do you understand what I'm trying to say? Two-way. Ask, ping pong. Yeah? And advise him to eat plenty of fruit and veg. Drink plenty of fluids. And you can ask him about the 2 out of 5 portions a day. It's known in UK. If you go to Asda, if you go anywhere, you know, when you go to buy vegetables, it's written the 2 out of 5 portions. What is the name of the 2 out of 5 portions? It's like you should involve 2 portions of fruit in your food a day. It's known. All English people know the 2 out of 5 portions a day, which means that you should involve 2 foods a day. So, how many points I've spoken about when you advise about diet? Number 1, white meat, more than red. Number 2, olive oil. Number 3, grilled food. Number 4, you can even advise him to eat fish. Fish, yeah, 2 portions of fish a week. Number 5, fruit and veg, plenty of fluids, and the 2 out of 5, which is a day, which is fruit, 2 portions of fruit. Guys, this is like to tell you, but it's not about telling him. It's about how you tell him. It's not about do 1, 2, 3, 4. No. What do you think if you can do that? What about that? Can you do that? I know it can be quite tough. I know it can be quite difficult, but think about it. It's about how you tell him, yeah? Number 2, how about advising him when it comes to exercise? If you speak to him, DESA, yeah? Guys, I'm talking about DESA now, which is A and R, advice risk factor. If you speak to him and he doesn't do any form of exercise, you can start telling him, well, Mr. Andrew, if you say to him, do you do any form of exercise? No, doctor, I don't. It's tough. I'm busy. Please. So when you start to talk about exercise, Mr. Andrew, I know it can be quite tough sometimes. You understand? I know how difficult it is. Even me myself, sometimes I find it quite tough to find the time. But please, we don't want you to have this heart attack again. So what do you think? What do you think of you starting bit by bit? Mr. Andrew, you don't need to start as like hardcore. What do you think? Mr. Andrew, how far do you live away from, for example, your work? For example, well, doctor, I drive. I go to my job drive. What do you think of parking a bit further from your work and you can have a walk? Mr. Andrew, when you go to work, is it in the ground floor, is it in the first floor, or do you use the lift? Well, I use the lift. What do you think of going up the stairs? Mr. Andrew, when you do shopping, what do you think of parking the car a bit further in order for you to have some walk? Guys, that's how you advise. Can you do that? If you do that, it will decrease the risk of you having a heart attack. So please make it two-way conversation. Please, it's all about how you tell him. 3, smoking. Smoking. If he tells you, I smoke, how would you advise him? Mr. Andrew, Smoking is one of the risk factors why a patient can have heart attack. It is also one of the risk factors why a patient can have high blood pressure and plenty of medical conditions. Well, doctor, it relieves my stress. Well, yes, when we speak to patients, sometimes they do mention that sometimes it relieves their stress. Why don't you think of something like some exercise, something that you like doing when you feel stressed? You can do so. Mr. Andrew, smoking is one of the major risk factors why you can have heart attack, and as I mentioned, it is life-threatening. Think about it. Give it a thought. When you're ready, I'm sure we can help you. We can refer you to clinics, smoking cessation clinics. We can give you some nicotine patches. We can offer you plenty of things that actually will help you quit smoking. No rush, Mr. Andrew. Take your time, think about it, and you are here whenever you're ready. What do I do now? And I make it as, I'm not here to force you. Think about it. It is a choice. But does he know it's a risk factor? Does he know MI can kill? Does he know? I know. Khalas, I told him. Okay? Then alcohol. Again, alcohol, if he drinks a lot, if he drinks occasionally, you cannot say anything. But if he drinks a lot, then you can advise him. Again, excess alcohol. Excess alcohol. Alcohol can damage your health. But if he said to you, I drink occasionally, don't even mention it. You understand me? Because drinking is okay. I'm not saying it is okay. I'm saying if someone is drinking, it's fine. Medically, occasionally, you cannot judge him for it. You cannot say anything about it. Okay? Now, after all of what I have mentioned, what did I cover here? A and R. Yeah? Only A and R. Advice and risk factor. Are you lost? So, M, medications and investigations. M, multidisciplinary team. S, safety netting. M, medication and the investigation I've mentioned to him. I said to him, I can see from my note, can you see the question? That the consultant has prescribed to you some medication. Do you have any concerns? No, doctor. The second M is multidisciplinary team. Multidisciplinary team is me, I can involve dietitian. Why? Diet. I can involve physiotherapist. Why? For exercise. So that's the multidisciplinary team is the fact that when you advise them, and you can even mention it in diet. So, whenever you're ready, we can refer you to dietitian. Whenever you're ready, we can refer you to physiotherapist. Whenever you're ready, we can refer you to smoking cessation clinic. So you can mention the multidisciplinary team, which is DESA. Dietitian for diet. Exercise, physiotherapist. Smoking cessation clinic. And finally is safety netting. Safety netting is what? At any time, you have central crushing chest pain, going to the left shoulder, please come right away. Clear. So this station is 8 minutes just to advise about DESA and medical condition. Sometimes they change something. They throw in the middle, blood pressure is high. So I can add one more line. The blood pressure is, or the patient is hypertensive. For you to say to him, you should go for the follow-up and, you know, to make sure it's checked all the time. And, you know, do you understand? Yes. So the next station, and there are some questions the patient can ask here. Doctor, when can I drive? Doctor, when can I have sex? Doctor, when can I go to work? Okay, and in every single surgery station, MI, surgery, every single surgery, the patient must ask you. It's not optional. They have been asked, when can I drive? When can I have sex? When can I go to work? Okay? When can I drive? When? 6 weeks. When? 6 weeks. When you are able to do the emergency stop all the time. Emergency stop without feeling pain. Okay? When can I have sex? Again, 6 weeks. When can I go to work? 3 months. 3 months I can go to work. Okay? So 6 weeks driving and sex. 3 months work. Sometimes they are off for 6 months even. MRI. So next station. Next station, the same. Guys, just I will give you bullet points because the second station is copy and paste. In this station, number 1, the steps. Number 1, I built rapport. The first step was rapport. I can see from my note that I had heart attack. I'm sorry about that. How do you feel now? Are you in pain? How was the hospital stay? You understand? Number 1, rapport. How do you feel about going home? Number 2, the second point. So number 1 was step 1, rapport. Step 2 was assess knowledge. How much do you know about your condition? And then explain to him MI. 3 was P2. 4 was P3, which is DESA. 5 is arms. Copy and paste next station. So the next station, 1, rapport. 2, assess knowledge. 3 is P2. 4 is P3. 5 is what? Arms. Let's apply the same in the next station. The next station is Mr. Zimmerman. You are an FY2 doctor, 65 years old. Zimmerman make an appointment. He made an appointment with the clinic. Why? Because he's very concerned about developing stroke. About developing stroke. He's worried about developing stroke. The nurse has measured the blood pressure and it's 160/80. Sorry, 160/90. 160/90. So this is the question. I'm Dr. Fath Al-Bab, one of your doctors here. How can I help you today? Doctor, I'm very worried. Can you please confirm your full name and date of birth? Done. How can I help you? Doctor, I'm very worried about developing. Is it normal for anyone to worry about stroke? Not normal. So, I'll tell him, well, I'm here to address your concern. Can you please tell me why are you worried about stroke? So, this is our concern as a part of the rapport. Why are you worried about stroke? Doctor, I'm worried about stroke because my dad and my brothers, they both had strokes. How are they doing? My dad passed away and my brother is okay now and he's managed. Well, I'm really sorry for your loss. But let's have a chat and by the end of our consultation, I'll make sure I address your concern. The second point is assess knowledge. What is your background? Assess knowledge. What is your background about stroke? Or do you know what a stroke is? Assess knowledge. Well, doctor, I don't really know. So, would you like me to tell you? Yes. Stroke is, again, it is the same as MI, but in the brain. Blockage of the blood supply that's going to the a part of the brain. All right. Usually, I'm assessing his knowledge now. Yeah? Are you lost? Usually, patients when they have stroke, they develop weakness in their arm, in their leg. Sometimes they have slurred speech. Have you ever experienced the same presentation or the same symptoms? No, doctor. So when you assess his knowledge, when you explain about stroke, please explain about the symptoms and try to ask, have you ever experienced such symptoms? No, doctor. Then I will start by P2 and P3. I will say to him, Mr. Andrew, stroke can be caused by many factors. Again, some of them are modifiable. By that I mean, if we work on them, there is high chance of actually having this. However, some of these risk factors are non-modifiable, like the fact that, I'm sorry, they are 65 years old. It usually affects patients over 60, and the fact they are a male, it usually affects males more than females. And also, I'm sorry to bring these memories. The fact that your dad and your brother developed a stroke, family history, there is a factor as well. However, the good thing is there are some factors, if you work on them, it will be dramatic decrease in the risk. So, is it okay to have a chat in order to establish if you have these risk factors or not? Does he know why you are having a chat? Why? To check about the risk factors. Does he know what are the risk factors you're looking for in terms of the modifiable and non-modifiable? Yes. Does he know what stroke is? Does he know the signs and the symptoms? Yes. So now I'll start by P2 and, because P2 and P3 are the pan, it is the cause. Then I will say to him, do you have any medical conditions, Mr. Andrew? Like diabetes, cholesterol, heart problems, mini strokes, thyroid problems? No. And when I am asking about P2, please take the chance to say, the nurse has found that your blood pressure is quite on the higher side, 160/90. Has anybody told you? Have you ever had high blood pressure? Don't make us an assumption that he is hypertensive, because maybe he's not, maybe it's the first time, maybe because he's worried. Has anybody told you? He will say to you, yes, doctor, yes, I have been having a blood pressure for 2 years and I have not been going to the doctor. That's why I'm worried, because even my dad and my brother, they have, and they developed a stroke. He will tell you, yes, I know, that's why I'm here now, because they both had high blood pressure and stroke. So ask P2, which is P2, how many questions? 2. Have you had any stroke before? Past the history and medical condition. And in the medical condition, don't forget, don't be lost. There is a blood pressure mentioned about him. Don't forget, in this station, there is a blood pressure high. Okay? Then go to P3. P3, Mr. Andrew, is it okay if I have a chat about your lifestyle? Yes, doctor. So what is P3? DESA, diet, exercise, smoking, alcohol. DESA. Ask about DESA in details, because it's the station. DESA. Then what is the final step? ARMS is you advising him about lifestyle. So A, advice. R, risk factor. M, medication investigation. M, multi team. S, safety netting. So Mr. Andrew, and exactly the same way I advised the MI about DESA, guys, I will advise this patient about DESA. But do not advise him about something that he doesn't have, because it will be scripted. If he eats healthy, fruit and veg, plenty of flavors, grilled food, would you advise him? What would you do? You will go to? Perfect. You will praise him before you go to exercise. Well done. Keep up the hard work. That's very good. So please, A and R. Should I repeat them again? No. Diet, how to advise. Exercise, how. Smoking, how. Alcohol, how. More important than telling him is the way. The way you say it, not saying it. It's the way you say it. Make it always optional, always two-way conversational. Then the M4. M is for medication and investigation. This patient was coming because he's worried about stroke. He's worried about stroke. What would you like to do for him before he goes, because he's in the GP clinic? I will do al-hilla. I will check blood sugar. I will check cholesterol level and thyroid function test. So, because thyroid is the most common cause for AF, blood clot, you know. So, investigations. So, I'll check the what? Diabetes, blood sugar, cholesterol, routine blood, and thyroid. What about the medication? I said M for medication and investigation. That's in day 1 in the course. M is for medication. I will give him 2 things. Statin is a must, guys. This patient, statin, right away, start him with statin. Dr. Mo, why statin? Why should we start doing it? Guys, Q risk will be high anyway. Family history, high blood pressure, age. Male. How many factors? Male, age, family history, blood pressure. So I'll give him medication for the blood pressure. Do I need to mention? No. Medication for blood pressure. And I'll give him statin. Then multidisciplinary team can be who? Dietitian, can be smoking cessation, can be physiotherapist. S4, safety netting. Safety netting is slurred speech, which I mentioned. Weakness, arms, legs. By the way, these stations, if you read any script, it is written in 7 pages. People write about, but we don't know what should we follow. The map. This is the map. Educate him what MI is, what stroke is, factors are, arms. Okay? So safety netting. And if he asked you, so can he, I mean, in this case, he should stop what? He should stop driving. Can he drive? Can he drive? Can he? Yes, yeah, brother. I attacked them. You know, when you attack someone, when you say he should stop driving, yes. It's just a question, like, you know, like, can he stop driving? He's got nothing. But the other patient, advise about driving. He should stop driving. The other patient. The other patient, can he have sex?
No.
No. For 6 weeks, okay? Always they ask about sex, driving, exercise, work. All the time, in all cases, angina. There's another case, angina, stable angina. When can I drive? When can I have sex? How many weeks a stable angina patient, how many weeks they should take in order to drive? How many weeks? 6 or 5?
Nothing at all.
No. They should have sex fine, drive fine, work fine, everything is fine, yeah? Stable angina. And we can actually put a stable angina here, you know? By the way, stable angina is the same, yeah? So,
If his work also, doctor?
it's fine. Here is fine. Stable angina, everything is okay. Stable angina. It's not our topic, but just in case. Stable angina case. حبيبي عسلية. Boss, send me the code. You going home, yeah? The code, I don't know the code. Where are you going, Mustafa? Home? خلاص? So, be careful because in this case, stable angina is fine. Everything is fine. Everything is fine. Okay? Stable angina. Everything is fine. Now, third station. What is the third station? TIA. 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 Okay? Write down. This is the most common station in PLAB 2. The next one. "69 years old. Liane presented to the A&E. This time she's female. Okay, she's a female this time. Presented to the A&E with facial weakness, unilateral limb weakness, slurred speech. So, slurred speech and unilateral arm and leg weakness. On evaluation, blood pressure 160/90. High, 160/90. Neurological examinations are normal. Talk to her husband. Again, the station, whom you talking to? Husband. What did she have? She's in the hospital now for unilateral arm weakness, limb weakness, and slurred speech. Why do I repeat the finding in the question? Because if you don't understand the question, you will fail the station. One thing, if you don't understand the question, you fail the station. That's why I'm saying to you, I am emphasizing on the words. Neurological, normal. Don't mention examination. Examinations were done. Do not mention examination. What about the blood pressure? High. Clear. So in this station, you don't examine. Do you need to examine? No. Okay, this station, be careful because CT scan was done and it was normal. Also write down. CT scan was done and it was normal. So do you want to do CT scan? No, CT scan is done normal. Neurological examination normal. Talk to her husband. She had weakness. It's basically TIA. Basically. However, again, I will focus on some point that some questions that you must ask. So, Rapo, hi, I'm Dr. Fatih Al-Bab, one of the general doctors here. Can I please confirm your full name and? No, you talk to the husband. Right. So, can you please confirm your full name? My full name is such and such. Can you please confirm your wife's full name and date of birth? For your wife's full name, date of birth. Okay? I can see from my notes that you brought your wife because she had weakness and slurred speech. It's written in the question. Yes. Can we please have a chat about her condition and about her health? Yes. If you want to be strong from the start, but before we go, do you have any concerns? Before we go, do you have any worries? Why do I need to ask about concerns and worries before I start? Because I want to know what concerns, so I work on it as I go. Clear, guys. Concern. Yes.
Is there any consent? Like,
Yeah.
In this station, consent is taken. It will be taken. Consent is taken. Talk to the husband. Yes.
Okay.
Yeah. So he will tell you, doctor, what did she have? He will tell you, for example. Definitely, I will come back to this. I have to acknowledge. Definitely, I come back to this. But can we have a chat? Yes. Can you please tell me what happened? So what happened, doctor? She had weakness in her arms, in her legs, and when I was talking to her, she couldn't talk. She couldn't articulate words. I was very worried about her. What is the first question?
How long did it last?
Oh, but before that, I would say to him, just before she had these symptoms, what were she doing? What was she doing? Doctor, she was cooking. She was sitting on the couch, number one. So what was she doing just before? So I'm trying now to ask about, yeah, the incident, the P1. So just before she had these symptoms, what were she doing? What was she doing? She was doing such and such and such. Okay? Did she complain of any dizziness by any chance? No. And the strongest question, did she lose? Very important. Very important. Guys, I need words. In this, what words?
Yeah.
Did she lose consciousness? No. Did she have any fits? Are they all logic questions? Stroke, fit. No, doctor. Okay. For how long did the weakness? Very important question. For how long did the weakness last? Because with TIA, it's short period. So he will tell you, doctor, it lasts for 60 minutes. Okay? What did you do? I rang the ambulance, doctor. This is the start of the station. So I only asked the relevant question. What happened just before she had the symptoms? The symptoms, for how long did it last? Did she lose consciousness and then go to P2 and P3, which is the score of the station? P2, has she had this before? Has she had this before? Does she have any? Because P2, two questions. Has she had this before? Yes or no? Does she have any medical condition? Like what? Diabetes, cholesterol, high blood pressure, heart attacks? And there you can say to him, you can use that word that's written. The nurse has found that the blood pressure when we measured it was quite high. Has she ever complained of high blood pressure? Do you want to know it's a chronic, acute, just now? So ask about the blood pressure. Now, I will go to P3, which is Daisa. Mr. Andrew, is it okay if we have a chat about her lifestyle? Yes. Diet, exercise, smoking, alcohol. So ask about diet and exercise and smoking and alcohol. He will tell you that she doesn't eat healthy. He will tell you she doesn't exercise. And he will tell you that she doesn't smoke and she drink alcohol occasionally. So diet and exercise, main thing. Then go to arms. Go to arm. But before you go to arms, do you know what she's having?
Yes.
What she's having? TIA. So we need to assess his knowledge. We need to explain to him. Mr. Andrew, from what you have told me and recap. So when you give provisional diagnosis, try to recap the finding. From what you have told me, you've mentioned to me that she had weakness in her arms and legs and slurred speech. And you mentioned that it's lasted 60 minutes. You also, when we examined her, we found that all examinations were Normal. Do we know?
Yeah.
Yes, it's written. And also we have done a scan on her brain that was normal. That's why we suspect a condition called TIA, transient ischemic attack. Have you heard about it? We call it mini stroke. Well, no, doctor, I didn't. TIA is like mini stroke. So basically, decrease in the blood supply. Momentary stoppage of the blood supply that's going to the brain. So, a part of the brain. So, momentary decrease in the blood supply that's going to her brain. That's why she developed these symptoms. Now she is fine. Is she fine now?
Yes.
Yes. However, we are worried about this may happen again, or we are worried in case she develop a stroke. That's why and start talking about arms. That's why, as you've mentioned to me, and then talk about diet, exercise, smoking, alcohol, but she doesn't smoke. She drinks alcohol occasionally. Don't mention it. So talk about smoke, diet, and exercise. So always advise risk factor, advise risk factor, advise risk factor. Then go to M. What does M stand for? Medication and investigation. So again, Mr. Andrew, talk about medication and investigation. So investigation, yes, we can do some bloods because, yeah. So what are the investigation for the TIA? TIA definition. What is the definition?
Transient ischemic.
Yeah, so definition transient is that it is look, decrease. Write down this line. It is decrease, which is the provisional diagnosis. Decrease, momentary decrease in the blood supply that's going to the brain. Look, decrease in the blood that's going to the brain. Why there is a decrease in the blood that's going to the brain? Due to either problem in the heart or narrowing of
Blood vessels.
the blood vessels. Okay, that's it. Dr. Ma, the blood supply is decreased
Yeah.
for two reasons.
Problem in
Either problem in the heart or the blood vessels are narrow. So read the definition. Decrease in the blood supply going to the brain. Blood. What do you want to do in the blood? All the blood. Clotting profile, cholesterol. Are you lost?
the no.
Okay? He's the producer now. He's, you know. Decrease in the blood. So what's the first thing you're gonna do? Blood. That's going to the brain. What do you do in the brain? CT scan, but it was done.
It was done.
Okay, but if it was not mentioned,
We do it.
mention it. Brain. Yeah? Due to problem in the? So what do you do in the heart? ECG, heart tracing, and heart attack markers as well, and further echo. Or it could be narrowing in the blood vessel in the head and neck, so Doppler. That's it. So if you read the definition, you will get there's a decrease in the blood investigation coding profile, cholesterol. That's going to the brain, CT scan, because of problem in the heart, ECG, or either in the heart or blood vessel, Doppler.
Doctor, please.
Yes?
We haven't asked about lactose.
Sorry?
Medications, allergies, family history.
You don't. In these cases and social, psychosocial, if you have time, but practice the station, practice, then try to see if the time fits. If it fits, you can add whatever you want.
But family history is related.
Family history is important. Like the MI, like you can ask family history. This is important. Because it's one of the non-modifiable risk factors. Yes? Yeah. So, the M stands for medication and investigation. Investigation mentioned. Okay. What is the medication?
Blood pressure. Statin.
Statin,
Blood pressure.
blood pressure medication, aspirin. Guys, 9 out of 10 don't mention aspirin. Seriously, in the mock. Imagine in the mock, under pressure, nobody mention aspirin. So please, in the medication, I said A advice, R risk factor, M medication and investigation. We know the investigation. And the investigation we know from the diagnosis, one line and translate them. But don't forget aspirin. Aspirin. Don't forget aspirin. If you forget aspirin at your own risk, please aspirin. Okay. CT scan was normal, so it's not hemorrhagic. It's not Because the stroke is hemorrhagic or ischemic.
Yeah.
Can you give aspirin in
No.
hemorrhagic stroke?
No.
But how do you know it's ischemic?
The CT.
CT scan is normal.
Yeah.
Because if it was hemorrhagic, it's going to be normal. But if it's CT scan is not mentioned in the question,
We'll do a CT.
if CT scan is not
Don't say aspirin.
mentioned, don't say aspirin. Say we'll do CT scan.
And fine.
It could be normal. It could be
Yeah.
normal. At this case, we'll give aspirin, and it could show that there is hemorrhage. We don't give aspirin. Yeah.
Okay.
So if CT scan is mentioned normal, please aspirin, 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 aspirin. TIA, I will call it the aspirin station. TIA aspirin. TIA aspirin. Wallahi, whenever we bring it in the mock, 9 out of 10. No aspirin. They don't mention it. M, multidisciplinary team, which will be who? Referral to TIA clinic.
Okay.
Referral, write down guys. Referral to TIA clinic within 48 hours. Is that, what's that?
Dr. Mustafa, please bring it to him. Okay?
Gave it to him.
Yeah.
Oh, he forgot to
We
me.
got it.
Okay, okay.
And it's a
ماشي عسلية. I love you. So please, M is multidisciplinary team. Don't forget TIA clinic within 48 TIA clinic, TIA clinic, TIA clinic, TIA clinic, TIA clinic within 48 hours. Some doctors will say, Dr. Mo, TIA clinic could be for a week, could be after 5 days. Is it urgent here within 48 hours? I will say yes, because A, B, C, D score, guys, because the score here is always high. How old is she? 69, 1 point. Because 1 point, 69. Weakness, unilateral. Slurred speech, 60 minutes, all these points, yeah? And she's already known to be hypertensive. Score of 5.
Yeah.
Because the guideline score 4 or more, urgent. And in the exam, they will never bring less than 4. Never. Never. It's always 4 or more. But you don't need to go with the patient into the score and the Q risk and the, you don't need to go into these scores, even with the stroke. You know, you don't need to, unless it's written. If it is written in the question, the word the Q risk or ABC score, A, B, C, D, 2. That's what the score called in TIA. A, B, C, D, 2 score, yeah? All right? That's the score in the TIA, which is, do I 48 hours or more? It's always 48 hours, all the time, okay? Because always the score is more than 4, all the time. The fact, the age, weakness, slurred speech, 4. You understand? So don't forget aspirin, don't forget multidisciplinary team, which is TIA clinic referral, and the S safety netting. What is the safety netting? FAST. What is the safety netting? FAST, F-A-S-T, 999. FAST, 999. So, FAST, F, facial weakness. A, arm weakness. S, slurred speech. T, telephone, 999. So, FAST, always tell him if she's complaining of facial weakness, arm weakness, slurred speech, telephone, 999. So, that's FAST, 999, safety netting. Always safety net the patient, and it's written at any boss in UK. All the bosses, FAST 999. FAST 999. Okay? Diabetes. Guys, at the start of the session, I said stroke, TIA, MI, diabetes, yeah? So the last thing is diabetes, yeah? So, diabetes. Don't forget to give medication for the high blood pressure, yeah? TIA station. Yeah, don't forget to give medication for high blood pressure.
This is statin, this, please.
Of course, statin, of course. Statin,
What else?
medication for the blood in the TIA station, yeah? In the TIA. Statin, medication for the blood pressure, and aspirin.
Aspirin.
Okay? دكتور احمد باهي ماشي باهي you know باهي ها yeah you are tired seriously yeah you look finished okay diabetes stations guys diabetes stations with any station diabetes we know look it's pan station yeah diabetes pan station because it's the last stations in the pan station diabetes so with any station diabetes DESA any station diabetes DESA and with any station diabetes I need to ask about cholesterol do you have a doubt cholesterol heart attack no high blood pressure no stroke, mini stroke, diabetes, they are all linked. Guys, these are the modifiable and the non-modifiable risk factor for anything of the 4 things I said: MI, TIA, stroke, and diabetes. And these stations mostly about lifestyle modification. That's it. Because you are not a diabetic specialist, you are not stroke specialist, you are just an FY2, T-boy, come here, go and talk to this patient, he's angry. Go and talk to this patient, she's upset. Go and calm him down. That's our job in the hospital, FY2. In the hospital, the job is, you are the receptionist. Seriously. We don't want you to manage a stroke, but we want you to spot a stroke. We don't want you to manage TIA, but we want you to think of it. Whenever you have a patient, think of TIA, think of MI, yeah? So, diabetes stations. Let's learn some principles with any station of diabetes, and then we'll start. It will take from me like 15 minutes, yeah? Any diabetes station, it will be counseling. It will be, we are talking about counseling station. This question will say he is diabetic. So, the start will be, how is your diabetes? How is your diabetes? Yes. What do I mean by how is your diabetes?
Treatment, compliance.
When was it diagnosed? Since when have you been diagnosed? Do you measure it? What was the last measurement? Is it controlled or not? Are you on any medication? If he said yes, do you follow up regularly? And finally, do you have any, and ask about the complications. Do you have any what? Any numbness or tingling in the hands or feet? Any vision problem? Any chest pain? Any pain while passing urine? How many questions? 4. 4 questions with 4 complications. 4 questions with numbness hand and feet, number 1. Okay, neuropathy. Vision problem, number 2. Chest pain and pain while passing urine, pain problem passing urine. That's it. So now, this is the first point, which is diabetic questions. Diabetes questions. Diabetes questions. If the patient is diabetic, I will ask about the diabetes questions. What are the diabetes questions? Simply, how is your diabetes? Open question. How you living with it? Yeah? How is it? How's your diabetes? When was it diagnosed? Yeah? Do you measure it? Is it controlled? What medication are you on? Do you follow up regularly? And then ask about the complication, which is any numbness or tingling hand and feet, vision problem, chest pain. Guys, how long will it take for me to ask these questions? Guys, literally 1 minute. Then, look. Then I've asked the diabetic questions. Doctora Anna, how are you?
Good.
Then go back, come back to reality here. After diabetic questions, what is this topic? The pan. The pan. So P2 and
P3.
because what is the pan?
P2.
So I will go here P2 and P3, which is P2. What is P2? P2 is the 5 medical conditions, but be careful because diabetes is diabetic. Don't say to them, do you have any diabetes? كده احنا لبسنا. Do you have any diabetes? No. So the 5 condition, but he's diabetic. So don't ask about it, yeah? So apart from diabetes,
Do you have any medical condition?
any other medical conditions? Like what? Like cholesterol, for example, like high blood pressure, like have you had any heart attacks before, strokes, mini strokes, thyroid? So ask about the medical conditions. And P3 is DESA, and this is the problem. What do you mean by this is the problem? The problem will be
The diet.
in DESA. The problem will be in DESA. Oh, the problem will be in DESA. And after you ask about DESA, you will come forward to arms, and the station is finished. But after I want to read the station for you first. Arms is for advice, and R risk factor. A and R, advice and risk factor, and it will be, guys, what is the cause of diabetes? Lifestyle, smoking, alcohol, diet, exercise. So, advice. Yeah, family history. Yeah, advice. Then M is for medications and
Investigation.
investigation. Always investigation, blood sugar, hemoglobin A, 1C, cholesterol. Do you need cholesterol? Yeah, cholesterol, hemoglobin A1C, blood sugar, yeah, and
Heart racing.
the rest, which is ECG, heart tracing. This is the blood. Then medication, if it's new, we'll give you medication for diabetes. If it's not new, we'll review your medication. Multidisciplinary team, diabetic clinic referral, dietitian referral, and if he's having a problem with his feet, podiatrist, if he's having. So, diabetic clinic, and in the diabetic clinic, guys, they have the ophthalmologist, they have the, podiatrist, kidney specialist. So diabetic, we refer to diabetic clinic. And the S is for safety netting, is you can safety net him for the complication. What is the complication of diabetes? If you have any numbness or tingling, vision problem, chest pain, or if you even feel like drowsy, or dizzy, hypoglycemic. Okay? So let's start with the station and let's apply this on the station. So this is the diabetes counseling station. Guys, if you noticed, I don't go too much in history. Did you notice?
Yeah.
Diabetic question, done. Since when, how, what medication, measured or not, controlled or not, 5 or 4 complications. P2, 5 question. Have you had any problem? Like P3 is DESA, which is my problem. DESA is my management. Okay? Now, the first scenario is basically about Mr. George Tyndall. That's his name, George Tyndall. It is about uncontrolled diabetes. What do you mean by that? Dr. Anna, it's a patient who's not controlling his diabetes. This is first station. That's it. A patient who's not controlling his, that's it, and counseling. Please don't go into details of, it is counseling about lifestyle. So, the station is 56 years old George Tyndall has been diagnosed diabetes since the past 14 years. He came to the GP clinic 4 months ago and he was giving insulin for 1 month. He never come back. And he missed his last 3 follow-ups. Never come back again after, like, he was supposed to come a month later. Talk to him and this is concerned. He's here today. Do you understand anything from the question?
No.
First thing, he's not compliant, and that's it. This is the station. Okay, do you think the medication will be the same? Do you want to review it?
Yes.
Yeah, because he's not been for 4 months. Do you want to do the blood investigations, like the blood sugar, everything?
Yes.
Do you want to advise him about lifestyle?
Yeah.
This is the station, guys. Please don't go into too much differentials. No, the station is lifestyle, advice, follow up, monitor, review medication.
Ask why.
Yes,
He
of
came
course,
this time.
of course, yeah. Why did he come this time as well?
Yeah.
Very good. Why did he?
you can't
And why
blind
didn't he come before? Yeah. You see, when you think superficial, when you think like, you can bring these questions. But if you don't think like this, thank you very much, Dr. Anna. Dr. Anna is like, has brought monsters to just like damage my heart. There is bonding now, Dr. Anna.
Yeah,
Seriously, how long have you been in the academy for now?
I don't know.
But some time.
Yeah.
I've been seeing you for a few weeks.
Tomorrow will be my last day.
Sorry?
Tomorrow is my last day.
Wow, I did hasad. Tomorrow is my last day. You've been seeing me for a while, tomorrow is my last day. You understand? Tomorrow is the last day. When is your exam?
Following Friday, 22nd.
22nd. Okay. So, superficial questions in this case. Why today? But don't say to him, why did you come today, brother? I wanted to go home and
It's anyway.
No. Is there any specific reason why you came today?
Yeah.
Because you've missed the last 3 follow-up. Why did you miss that follow-up? How is your diabetes?
I'm beginning.
I can see from my note that you, first of all, I'm Dr. Fatih Al-Bab, one of Dr. Zeed. Big smile, Mickey Mouse smile. Then can you please confirm your full name and date of birth? I can see from my note, Mr. Mr. George Tyndall, that you have missed the last 3 follow-ups. Thanks for coming to see me today. Is there any reason why you missed them? Do you have any specific concern today? Which means a nice way of Why today? Why tomorrow weekend I'm off? Why today? You know? And then, doctor, because I have some concerns. Ask about the concern. I can see from another you've been diagnosed diabetes for the past. Can I have a chat about it? How's your diabetes? It's like they are in a relationship. How's your diabetes? It was diagnosed 14 years ago, doctor. Do you measure it? Yes, I do. Is it controlled or not? Because controlled after measurement. Is it controlled or not? I can see from a note that you came last time 4 months ago and you were having insulin and did not come back again. Yes. Are you following up with the medication taken as it was prescribed for that time? Yes. But why didn't you come for the past 3 months? He will give you a reason. You will take it later because of the compliance. Don't talk about it now. So we've asked since when, how, measured or not, controlled or not, and then ask about the complications. You wrote the questions. That's what I'm asking now. The questions. Numbness, tingling, hand and feet, vision problem, chest problem, any chest pain, any problem passing urine. Then I will go, apart from diabetes,
Do you have
any medical conditions like cholesterol problem, like have you had heart attacks, strokes before? Mr. Andrew, Mr. George, can we have a chat about your lifestyle? Then ask about the lifestyle. And this patient will give you complications. He will tell you, I have numbness and tingling on my hand and feet, that's why I came. Or I have vision problem, that's why I came. Complication. Because he's not following up, yeah? Then, after asking about DESA, you will go to arms. In arms, advice and risk factor. Advice and risk factor. As you mentioned to me, you're eating such and such and such. I highly advise you such and such and such. And talk about the diet as we've discussed in the MI. Guys, talk about the diet as we spoke about it. Exercise as we spoke about it. Smoking as we spoke about it. Exactly. Then M for medication and investigation. So George is coming to you today after 4 months. After how long?
4
months.
Doesn't he deserve like some tests?
Yeah.
Blood,
Hemoglobin.
sugar, hemoglobin A1C, cholesterol level. Yeah, does he deserve or not?
Yes.
So which is, guys, I'm following the structure. Yeah, arms, ARMMS, M medication, investigation, hemoglobin A1C, blood sugar, okay, and then investigation, medication. I will review. You don't need to know what type of insulin, what type of. You sure? You don't want to sleep?
No.
Yeah. Okay. You sure?
Yeah, I'm sure.
Yeah. So medication and investigation. Medication. Do you want to give him new medication? No. But you will say to him, "We'll review your medication because you're not gonna give new medication. He's an insulin. But you will review the medication. Then multidisciplinary team, referral to diabetic clinic, and dietitian will be involved in this case. Diabetic clinic, dietitian. If he's got a problem with his eye, if he's got hand and feet,
Yeah.
neurology. You understand? Diabetic
Yeah.
clinic. So that don't forget, please. In this case, diabetic clinic and safety netting. If no complication, we'll safety net him for complication. Complication like MI, like numbness, tingling. If there is complication, to safety net him for the rest. The complications that I mentioned: neuropathy, hand and feet, numbness, tingling, vision problem, chest pain, pain on person urine problem. This is the station. It is uncontrolled diabetes. And uncontrolled is no. Next station. Guys, I want an honest opinion. Am I going fast?
No, this is great.
No.
This is great.
Because within like an hour and a half, we'll be finished like what we do in the course of 1 day, the whole like 8 hours.
The first course, I used to listen to it twice the speed.
Yeah,
Because of
twice.
the guys. Yeah.
Twice.
I
And,
love the
yeah.
long
Sorry?
course. I love the long course.
It was
Maybe-
great, but this is
The
much
best-
better.
Best time of my life.
Wow.
It was so fun.
Yeah,
Wow.
Just don't remove the long course. Keep it because some people like to
Me too.
Yes.
repeat and listen
It's
to
kind
the
of like fun,
questions.
you know.
Yes, I will leave both.
And this is perfect for the revision.
Yes.
If someone
For
wants
people
to
who-
Yes, yes, I will leave both. I will leave both.
Yeah,
Yeah.
leave them.
Huh?
Leave
Yeah,
them. Yeah.
Leave them. Yeah.
There's
The
some
old
highlights
ones are
that
wonderful.
cannot
Huh?
be missed.
The old ones.
This is
are
the sense of
wonderful.
humor.
Yeah.
You see this boom finish, you know. The other one was like quite, you know.
No, and others ask questions. We listen to the questions. Sometimes it's what we think about.
Yeah, just we have some businessmen in the course. There's some businesswomen who just don't have time. I don't have time.
Great
That's,
for the
yeah,
time management.
next station, guys. The next two stations: diabetes, hypoglycemia. The next two stations: diabetes, what?
With hypoglycemia.
Hypoglycemia. However, I would like to give you a small hint that the next two stations, one of them, you need to filter the station, yeah? Before the exam, or when you are at the door, you need to filter. So the two coming stations, hypoglycemia, one is medicine, one is counseling, right? That one is medicine, one is counseling. What do I mean by one is medicine, one is counseling?
One is that.
One, he's fine. He's coming today, he's fine. He's got no problem.
Okay.
A week ago, he had some dizziness.
Okay.
He had something sweet, he was fine. But why did I have this dizziness, doctor? Tell me, why did I have it? Tell me, why did I have it? Then it's counseling. Brother, what happened last week? I went to a party. And what did you do? I take too much chocolate. And after that, too much insulin. And I was dizzy and I took something, it should have become fine. Yeah. What symptoms did you have? Okay. It's a hypoglycemia. Do you know what hypoglycemia is? Such and such and such. Okay? Be careful because there are many reasons why you can have it. And the causes are such and such. The symptoms are such and such. And when you have it, please make sure you stop driving. And when you make sure you don't drive, and make sure you take something sweet, station. Counseling station. He is fine. He's got no problem. He's got no issue. He just a week ago had dizziness. Sweet, normal. But today, كبرت في دماغه. Why did I have it? Today, brother, in my shift. Why did you have it? Why, you understand? This is counseling. The second station is hypoglycemia, new diagnosis. 30 years old, lost to consciousness, brought by the ambulance. They measured the blood sugar in the ambulance. It's 2. Okay, now he's fine. He's talking. Talk to him, and this is medicine station. Medicine, you are in the NE. So why do I say that from the start? For you to filter the stations. Because you guys, if I don't know, if I just like every station, no, filter them. So write down the first station, hypoglycemia. We're still in diabetes. So diabetes, 3 cases so far I discussed. The first one, under the title, uncontrolled. Done, finished. The second one,
Medicine.
diabetes counseling.
Okay.
What do you mean the hypoglycemia counseling? Don't worry, he's fine.
Okay.
He's just coming today to know why. Coming to know why. That's it. Does he have any symptoms today? No. So please make sure you filter, you know the type of the station you're dealing with, yeah? So the station is, you are an FY to doctor, Habibi. Look,
Yes.
look, I started 8 in the morning
Yes.
in the hospital. But 8 in the morning, I was in the ward.
Yeah.
That's why, And I'm still here now. And all of you guys going home. بجد يعني
You're full of power, man.
ها still ها no about خيال يعني I don't know if you leave me here for 10 hours I'm here I'm fine.
Monster يا دكتور.
I'm fine. لا I don't think
There's
ها
a problem.
key I don't
Okay, I'm still.
I love you Abu Hamid I love you man I'm not gonna be long yeah
Yeah.
so you are an FY2 doctor in the GP clinic 35 years old Eddie look known to be diabetic on insulin all right collapsed after injecting himself too much insulin a week ago yes today he's coming because he has some concerns today he's not why imagine a week ago yeah so see and in brackets put hypoglycemia counseling yeah hi I'm Dr. Fatih Albab and I'm Dr. Zahid can you please confirm your full name and date of birth okay I can see from my note that you're coming to see me today because you have some concerns how can I help you doctor last week I felt dizzy as if I'm gonna collapse and I was driving and I stopped and I took something sweet and then I became fine well I'm glad you are fine I'm glad that you made the right decision and you stopped driving okay so why did I have this doctor your concern is valid but is it okay if we have don't say to him it's hypoglycemia because you don't know you don't know yet you know he's diabetic diagnose diabetes. Is it okay if we have a chat about what happened? Yes. Can you please tell me what happened? The presenting complaint. Open question, guys. What happened? Well, doctor, I'm from Egypt. I've just arrived to UK. I love chocolate here because in Egypt the chocolate is very expensive. So I had to go to one of my friend's party. I ate too much chocolate. Too much. And because I'm diabetic, I injected myself with too much insulin, doctor. And all of a sudden I started feeling dizzy. Now you have a cause? Too much insulin. Okay? Well, I'm really sorry about what you've been through. Can we have a chat about your what? Diabetes. How is it managed? I can see from my note, you've been diabetic for example, 5 years, 3 years. It is written here. If it's not written, for how many years? Do you measure it? Is it controlled or not? Do you go for the regular follow-up? Do you take your medication as it was prescribed? What medications are you on? When was last reviewed the medication? That's it. The question for diabetes, and then the 4 complication. Any numbness or tingling hand and feet, any? No, doctor, no complication. That's what he said. Yeah? So now do you know it is hypoglycemia? Yes. From the complaint he gave, from the presentation he gave, and he's diabetic, and he told you too much insulin. Now, P2, P3 arms. Apart from diabetes, any other medical condition? Yes, no, whatever. Like cholesterol problem, like stroke, many strokes, no doctor, yes doctor. Mr. Andrew, is it okay if you, or Mr. George, is it okay if you have some chat about your lifestyle? Then talk about DESA, because in DESA, there's a problem. Hypoglycemia is what? Complication of diabetes. So talk about DESA, diet, exercise, smoking, alcohol. Now, after DESA, and before arms. After DESA and before, after I finish P3 and before I manage, what is the diagnosis? Hypoglycemia. So please tell him, Mr. Andrew, from what you've mentioned to me, you've told me that that day you took too much chocolate and you injected yourself with too much insulin. Yes, doctor. That's why you started feeling dizzy, because injecting too much insulin has caused decrease in your blood sugar, which we call it hypoglycemia. It is low blood sugar, Mr. Andrew. So, is it okay if we have a chat about your management? Yes, doctor. And then start talking about arms. A and R. What is A and R? Advice and risk factor. Don't forget that I am here to advise about his risk factor. Not, yes, not all the diabetic risk factor. No. So please, because what people do, they tend to talk about all risk factors in the world. No. As you mentioned to me, A and R, you have injected yourself with too much insulin. It is the reason why your blood sugar went low. So please, when you talk about arms, A and R is advice and the risk factor for what he has, not everything else. So advise him about the fact that he took too much insulin and took too much chocolate. And then you can say there are other risk factors if you have time. And you think the 6-minute pill not rang yet, and you are on arms, everything is fine, you can. There are some other risk factors, Mr. Andrew, and then you can mention, for example, sometimes the patient, if they have infection, sometimes patient if they fast, but they take the medication, so fasting. If you are fasting and you take the medication, hypoglycemia. Too much insulin, hypoglycemia. Exercise, hypoglycemia. So you can advise about things that he doesn't have after talking about things that he has. And don't forget, I said, between the P3 and between arms, what did I do? No, guys, after P3 and before arms, I have given him, if you leave the station without him knowing it's hypoglycemia and what is hypoglycemia, you will fail. So I spoke about A and R. Now I'll talk about medication. Medication and investigation. Because he's coming with a complication, so hemoglobin A1C, to see how well it is controlled. Any hypoglycemia is a complication of diabetes. And if a patient is coming with a complication, always hemoglobin A1C to check the control. So In investigation, hemoglobin A1C, guys, fasting blood sugar, guys, all the cholesterol level, ECG in the heart, and medication. Review the medication always, all the time. We'll check the medication. You understand? Then M is for multidisciplinary team. Any patient is coming with complication. Any patient with complication. Yes, any patient Anna with complication, diabetic team. Any patient, diabetic clinic. Any patient, as long as they presented with complication, diabetic clinic. Then S for Wallahi, 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 Wallahi. Today one of the doctors, she put on our Facebook group. She passed, she was put on the Facebook group. She's not, she's Indian. And she started saying, and I always remember Wallahi, Wallahi.
Yeah. The humor is great.
Sorry?
Wallahi, wallahi, the humor is great. 100%.
Wallahi, if you don't talk about safety netting, you fail. By the way, this station, if you don't safety net him, what is the safety netting in this station? Educate him. So safety netting, I will call it as education. Education? Yes. Education. What do you mean by education? Not just hypoglycemia. I will educate him. Guys, again, coming back to communication skills. Educate him. Mr. Andrew, do you know what hypoglycemia is? Safety netting. Because I don't want him to go through hypoglycemia again, because hypoglycemia can be life-threatening and it can lead to sudden death. So Mr. Andrew, I can even tell him in the safety netting, Mr. Andrew, hypoglycemia, I'm sorry to come across that way, is life-threatening condition. It can lead to, I'm sorry Mr. Andrew, sudden death. So is it all right if we have a chat about it to make sure you are well educated about it? Yes, doctor. So you need to tell him what hypoglycemia is, what causes hypoglycemia, symptoms of hypoglycemia, how to manage, what to do. Yes, so hypoglycemia is decrease in the blood sugar. As simple as that. What to look for? Usually the patient will feel hungry, dizzy, irritable, sweating. It is caused by, as you told me you inject, as you told me you injected so much, and also many other causes. Whenever you have this problem, please take something sugary or something sweet, or drink some juice. Education. So hypoglycemia, safety netting, education. If you leave the cubicle and he's educated about his condition, and you forgot 3 questions here, you forgot B2, you didn't ask Disafoli, you didn't think about Disafoli, you pass. It is about educating the patient about hypoglycemia. Like the stroke, if you leave the cubicle without educating him about fast, facial weakness, what to look out for, guys? It's being a safe doctor. Safe doctor is making sure that this patient knows what is hypoglycemia.
Can we bring it then forward?
Of course, you can bring.
Like not to forget.
Yes, 100%.
Or maybe not have enough time.
100%. Bring it anywhere. Bring it anywhere. You understand?
Before I ask you some questions,
Yes.
I would just like to let you know if these things happen again.
Perfect.
Please do.
Saying can we bring it early?
Sorry.
Leaflet, you can give leaflet, but leaflet people abuse it. People, they at anything leaflet. Not at any station people talk about leaflet. Leaflet, STI, diet. You know, you can give, but people, I don't mention leaflet because we abuse the word leaflet. They give it to anyone. So when you go to the GP has a big room, double the size of this, double. Then after he finishes, okay, we're talking about diet. 1 second, which diet is there? And he goes and the diet leaflet. It doesn't work. Leaflet is 4 or 5 things in black 2: stroke, TIA, diet, STI, OCP. That's leaflet. But that's why I don't like to talk about it, because we will use it everywhere. But you can use leaflet. Yeah. Okay. So educating the patient about hypoglycemia, very important. Now, the next station is filter. Hypoglycemia what? Medicine. Guys, medicine. Next station, doctor, what's your name?
Attila.
Dr. Attila is different but wait. This is diagnosed. You see? He's fine. That's why I say, guys, well, in Plab 2, you need to know where you're going and that's it. Just where you going. Because people, they take history in a counseling, yeah? And they don't take history in medicine. No. Yes. Because as you can see, guys, just Dr. Anna, just educating the patient will take about 2 minutes. Just educating the patient. Do you agree with me? To make it to a conversation. Don't forget to talk about driving, yeah? Next station is copy and paste, but medicine. Write down the question. 35 years old. Max was brought by the ambulance. Blood glucose 2. He became unconscious. Half an hour back. Now he is conscious. So is he conscious now?
Yes.
So it's not Simman, yeah? This is not Simman. This is conscious patient coming. Yeah, conscious patient coming. And his oxygen saturation is 98. Talk to him and this is concern. Okay. I will tell you exactly what happened in the station. Exactly. Open the door. I'm Dr. Fath Al-Bab, one of the general doctors here. Remember my words. Remember this very important station. Can you confirm your full name and date of birth? He will tell you full name and date of birth. How can I help you? I want to go home, doctor. Mr. Andrew, what happened? I want to go home. Can we have a chat? Remember this scenario. I want to go home. So, what is his main concern? Wallahi, wallahi, wallahi. He will not open his mouth until you say, why do you want to go home? Why do you want to go home? Doctor, I have a wedding to remember these words, guys, please. If the patient says something, don't let him repeat it again. You need to pick the concern quick. If the patient is having something, don't just carry on because you will look bad. Doctor, why do you want to go home? Because I have wedding to plan. And I'm the only one who will plan my wedding. Leave medicine. Leave hypoglycemia. Please focus into addressing his concern. Well, Mr. Andrew, well, Mr. Tony, can anybody plan it for you? Can anybody help you with that? No, doctor, it's me. Can you speak to your partner? No, doctor. And by the way, don't forget congratulations. Well, congratulations for your wedding, you know. Then give him options. No. Why do you talk to your partner? No. Why do you talk? You arrange a wedding planner? No, doctor. I wanna go home. That's it. You cannot. Then his concern going home. You asked why. He still wanna go home. What is the third step?
Ultimate risk.
Ultimate risk, which is at the same time mental capacity. Brother, do you know what you have? Do you know what you have? That's the way of life. Do you know what you have? He will tell you. No, I just become unconscious and no. You have a life-threatening condition. Guys, don't be scared. It is life-threatening. That's why, Dr. Maha, they put in the question, it is 2. Why do you think they put 2?
Extremely low.
Yeah, no. And to give you the chance of saying the word, and to give you the chance of starting the station, knowing it's hypoglycemia, because otherwise, you cannot say life-threatening, because you don't know. But they give it for that key. And the station, wallahi, main concern, going home, if you try to take history, no history. Anyway, life-threatening, do you know what you have? You have a low blood sugar. If we let you go home, it will be life-threatening and you might not even make it. Can I say it? Yes. Say it. You're not lying. Are you lying?
No.
Do you want to do false reassurance? You will not make it. Then, he will say, okay. Then, can we have a chat? When you ask him, can we have a chat? Then he will say to you, all the history in the world. He will not keep anything. He will say, I'm diabetic for 5 years, type 1, on insulin. Yeah? Today, I was running around preparing stuff. I did not take my... Sorry, I did not take food, but I injected myself with my regular insulin. Okay? And I'm being managing everything well. I go to my doctor, I follow up, but his problem that he did not eat and he took insulin. The other guy was chocolate too much, insulin. This one insulin and no food. That's clear. He will give you all his history. What if he did not give you all? What is your structure? Your structure? I can see you are being diagnosed diabetes. For how long? First question. You remember? You remember? For how long have you been diagnosed? How is it managed? What medication? Do you measure it? Is it controlled or not? And ask about the complication symptoms. Clear. And when you ask them, he will tell you everything. I'm on insulin, but last time I did not take it because I was running around. I did not eat, but I took my insulin. So the problem is fasting. He did not eat, but he took insulin. This is the questions of diabetes. Clear, guys? Then I will go to P2 quickly, apart from diabetes, any other medical condition. Then I will go to P3, but this station, in this station, is it counseling?
No, medical.
So please, it's not DESA. It is quick. And you're not gonna chill in DESA. You're gonna say later we can talk about the lifestyle modification because no time, it is medicine. Do you understand? Do you read my mind? So one is DESA. Sit down بقى كده وتشيل bring your minister and talk about this. Let's have a chat about DESA, ya brother. What do you eat, ya brother? What do you drink, ya brother? What do you smoke? But this no. This is medicine. That's why I said the problem is filtering. This is is it acute? When did he lose his consciousness? Half an hour ago. He just regained the consciousness. What do you think? He will say, "Ba'ah, what do you eat? Ba'ah, ya brother? You know, you need to have some olive oil, ba'ah, you know, white meat." And no, it's not that station. Black 2, counseling, medicine. They don't bring both in one case. They don't bring you to advise someone is dying. You understand? So make sure he's stable. So in this station, we want to ask about DESA. How is your diet? Do you smoke? And then you may not even ask about exercise. Just move on. Guys, I'm giving you just move on. And you can even in the management mention there are some lifestyle modification. We can have an appointment to talk about it. We can ask your GP to check. You are in the A&E. A&E, no chilling. A&E, yeah? So when you come to management, you can use ARM because it will go, or you can use the 7 steps. ARMS or, you know the 7 steps. What is the difference between ARMS and the 7 steps in management? The 7 steps in management for medicine. ARMS for counseling. So I will take ARMS out and I will use the 7 steps. And by the way, the 7 steps, ARMS. Yeah, but the 7 steps, which is admit or not. Yeah? Senior? Investigations. What are the investigations? Blood, urine, stool, image. I'm mentioning all of them. I always tell myself, I tell myself as well, in case I don't forget. I don't want to stool, I don't stool, but I want to put them, yeah? Step 4 is symptomatic and lifestyle. Step 5, specialist. Then, safety netting. So, I will say to him, we'll admit you. Will we admit? Yeah?
Yes.
First step, admit.
Yes.
Keep you in the hospital. Imagine if I don't want to stay in the brother, but I don't want to stay in the hospital. I want to go home. He's not gonna say that because you told him
Life threatening.
you're gonna die. Senior. Investigation. Blood, urine, stool, image. Any stool? No.
No.
Urine?
Yes.
Yes. Urine ketones, urine protein, glucose. Yeah. Urine glucose. Blood. I finished. Yeah. Blood. What blood? All hemoglobin A1C. Everything. Yeah. And then image, ECG, if you want. Yeah. Symptomatic plus lifestyle. Symptomatic plus lifestyle. This patient is hypoglycemia. What do you give him? Glucose. Yeah. Fluid that contains glucose. Okay? And when you give the patient to glucose, they put them sometimes in GKI. Glucose, insulin, potassium together. Okay? So the patient will be having a fluid that contains glucose and lifestyle. Now,
No.
we can have a chat. We can have another appointment to discuss some lifestyle modification. Specific treatment, which is specialist. Who? Diabetic clinic and dietitian as well. Safety netting,
Against the symptoms of
hypoglycemia, safety netting. Educate him, tell him about hypoglycemia if you have time. But if you don't have time, you can tell him you had a condition called hypoglycemia and driving. You have a condition called hypoglycemia, low blood sugar because you were fasting. I highly advise you that you don't fast, okay? And talk about driving. Driving is very, 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 very important. Yeah.
Doctor, he has been talking to me all this consultation. So why should I give him a JKI? Just I advise him to take
No,
something.
this patient, no,
Yeah.
no. He's been talking about his blood sugar is 2.
But he's awake. That means that they give him something.
I know, but still, they said it is 2 now. You're not gonna have a patient who's hypoglycemia with blood sugar 2 and give him something to drink. No. Something to drink 3.5, 3.2, 3, but 2 is and he's in the hospital.
Yeah.
You're gonna send Anna to get him Monster? Hospital, you understand me, guys?
Yeah.
Hospital, no Lucozade or Monster or no. Hospital, drip. They put him on a drip right away.
Okay.
Stop it.